OMIDRIA has had a huge impact on my clinical practice, especially teaching residents. I would say I was a non-believer. I had been to many of the talks and thought, this really sounds too good to be true. And one day, one of the reps came in and I said, I'll take one box because it'll just take me one box to show that OMIDRIA does not work. That was over 4 years ago. And I've been using OMIDRIA on every case since. It worked even better than I had ever hoped and expected it to work. I feel that it, makes the day much less stressful because we really don't have surprises now. Before OMIDRIA, we were having nurses mix up lidocaine and epinephrine and then hand it off. That was something we were injecting. But OMIDRIA has easily become part of our practice, not just because we as the surgeons love it, but it's also because our nurses and scrub techs love it. It makes life much simpler. They know they take that bottle, they put it in the irrigation solution, they pull a little bit out to have on the field for the beginning of the case, but it's the same way every day. And the huge safety factor is that this formulation is FDA approved, but manufactured in a process that's very safe and predictable. And I really wouldn't want to go back to either compounding or mixing medications that I'm injecting into an eye. OMIDRIA performs so well clinically. We oftentimes notice that our patients overnight have not had any pain or foreign body sensation. We have decreased inflammation. Very rarely do we have more than 1 to 2+ cell. Anecdotally, I've had patients referred to me as a specialist that have other issues, diabetic macular edema, and macular edema after branch vein occlusion, for several examples. And it's surprising that a week out, when the patients go to see the retina doctors, many times that edema and inflammation has resolved, and that was unexpected. So like I said, that in my anecdotal clinical practice, OMIDRIA has performed so much better than I had ever even hoped and imagined.